Could a problem with gluten be causing your hiatal hernia? Yes, absolutely. Now, when we talk about gluten, there's two major conditions that we want to talk about. One is celiac disease, which is an autoimmune disease. The other is gluten sensitivity, which is not an autoimmune disease. But what both of them have in common is that you require a zero tolerance policy to gluten, or a lot of things go awry in your body. So with celiac disease, because it's an autoimmune disease, what we know that happens is that the lining of the small intestine gets damaged to a very severe degree, and there's a lot of different symptoms associated with this. Gluten sensitivity shares a lot of these symptoms in addition to things like fatigue and headaches and having neurological complaints, having psychiatric complaints like brain fog and depression and anxiety, which isn't as preponderant in celiac disease, which is a little bit more digestive in nature, bloating and gas and diarrhea. But as we really see more patients, there is a very wide variety, and it crosses a lot of systems in the body. But what we want to focus on today is gluten and hiatal hernia. So what we know with hiatal hernia is that something is creating a lot of intra-abdominal pressure such that your stomach then gets forced up. And mostly what we see is that begins in the colon and the small intestine and with inflammation. And that's exactly what gluten does, whether it's celiac disease or gluten sensitivity. It is creating a degree of inflammation. So with celiac, it's degradation, damaging the lining of your small intestine. But with gluten sensitivity, it's also inflammation. So you don't see what's called the finger-like projections that line the small intestine. You don't see those degrading, but you see inflammation and you see leaky gut in both. And so leaky gut is when enough damage has occurred that the body's inherent ability to kind of defend the outside, so your intestines are obviously they're inside your body, but they're considered outside your body from an internal perspective, because the food going through your intestine sort of once things are broken down, the body's immune system kind of gives permission for what's in your gut, in your intestines, to leave and go out into your bloodstream. And when they leave and go into your bloodstream, now it's considered it's entered your body. So it's just a way to think about it. So if you think from your mouth to your anus, it's a closed system. So it has to go out. So of course, if it never left, then we wouldn't be nourishing ourselves, because the nutrients that we eat would just be in one end and out the other, which is, of course, not the design. But again, with leaky gut and inflammation, we have things that are partially digested going out into the bloodstream. We have inhospitable organisms that should have been constrained and destroyed by your immune system. That's not happening. So it just becomes a free-for-all with this leaky gut. Okay, that's how it inherited the name. Is like, we don't have this nice guards at the gate anymore saying, "Oh, you're wonderful piece of broccoli, you may enter." And it's like, "Oh, you're a parasite, we're going to destroy you where you are." So that whole system gets broken down, and the upshot of that is it's definitely a source of inflammation in the gut that then causes increased intra-abdominal pressure and is a source of causation of hiatal hernia syndrome. So we tend to find a number of causative factors with different patients, but one thing that we never don't do is to make sure whether someone is tolerating gluten well or not well. Now, within the confines of that, there's a difference between your immune system saying, "Wow, I really get inflamed when I see this protein, gluten," versus, white bread, the white pasta, all this white refined wheat is just not very healthy for you. So it's raising your blood sugar, and it's, creating maybe fatty liver and insulin resistance. So there's a cascade of just the junky wheat and what it can create, but that's different than an immune response. So someone could not have an immune response against gluten, but still, of course, not do well with a lot of refined wheat flour, you see? So there's there's the junk food category, and then there's, wow, my immune system really just can't tolerate this protein and creates leaky gut, inflammation, etc. So what we want to keep in mind is that it's important to rule this out, okay? It's really important to know whether you are gluten sensitive or have celiac disease. For celiac, there's about 11% of those suffering who get diagnosed. So we're very poor at diagnosing celiac disease. A bit better with gluten sensitivity. There's a test we use that kind of spans both, so we get a lot of good information. So if you've wondered about this, it's just really important to not miss it. Now there's other ways to diagnose it. I love the test because it's super accurate. There's ways of eliminating it out of your diet for a good 6-8 weeks and then reintroducing it. It's difficult. It's a longer period of time with gluten, which is why I love the test, but we're happy to help you, figure it out whichever way you need. But it's a piece of the puzzle we don't want to miss. So I hope you learned something from this video. Definitely give it a thumbs up if you like it. Subscribe to the channel so more people can get this information.